Hi everybody, welcome to Healthline. I am Gregory Zarian. So as you can see, I kind of dressed down today. It's summer. That means, as we always talk about, getting up, getting out, and just doing more outside, being a little bit more casual, getting some vitamin D, spending more time in the mountains and the hills, at the beaches with your friends and your family, and also with all that's going on in regards to the world and masks and social distancing. It just means, as I say to you all the time, just be aware, be courteous. If you are asked to wear a mask, wear your mask. You're doing it as a gift to me, and I'm doing it back for you at washing your hands, just paying more attention. And if you are not feeling good, stay home. You know, Adventist Health Glendale is there for you. Even with all that's going on with COVID, go in through their doors, ask questions, get tested, see your doctor. There's no reason why you still can't lead and live a happy, healthy life. So within all of that, the most important muscle I feel in our body is our heart. How much do you take care of your heart? How much do you know about your heart? Today, the conversation is all about aortic dissection and aneurysms. Joining us from Adventist Health Glendale, his specialty is cardiothoracic surgery and vascular surgery, is Dr. Vahram Ornekian.
Hi, nice to be here. I appreciate it. Thank you.
Great having you. And apparently our dads knew each other, so.
Yeah, it's quite a happenstance.
Yay to our dads, and they're really good-looking,
fun.
successful children. Why the heart? What got you into the?
Well, I mean, growing up seeing my dad doing foot surgery made me very interested in doing surgery in general, working with my hands, taking care of people. So that's something that's always been a part of me and grown up with that. And you know, looking at what's available in medicine,
Sure.
and where the needs are in medicine, I've always felt like heart and vascular care in general is something that's growing. It's a big problem. It's rampant in the community. It's the #1 killer of Americans for many, many years. And I think it's an opportunity to help people, and that's why I pursued that specialty.
Off the top of your head, because we already have to step out into our first break, in regards to heart health, what's the most important thing for us to know?
Don't smoke and exercise. See your doctor, take care of preventative things that you can do, taking care of high blood pressure, taking care of high cholesterol. Smoking is the #1 killer when it comes to heart disease, and people don't realize that. And quitting smoking is probably the most important thing you can do.
Now, you probably feel the doctor was saying that right to you, and he was. I smoked 2 packs a day for over 20 years. I've not had a cigarette in over 16 years. You can make that healthy choice. Why would you let something so small be so big in your life? More when we come back. Do not go away. Thanks. Welcome back to Healthline. I am Gregory Zarian. The conversation today is all about aortic dissection and aneurysms. Joining us from Adventist Health Glendale is cardiothoracic specialist and vascular specialist Vahram Ornekian. Did you ever feel pressured by your father to become a doctor as well, or did you feel that it was supportive?
That's a funny question, Greg. Actually, absolutely not. Quite to the contrary. My dad encouraged me to pursue just about everything outside of medicine as possible.
Oh, I love that.
And
I love that.
I fell into it mainly because, you know, I couldn't escape it. It's just part of who I am, and I think, you know, certain things you're just destined to do. So that's how I ended up here.
So, speaking of your destiny, what is your schooling? Where did you go to school?
So I went to UCLA here as an undergrad.
So did my dad. Okay.
And then I did my master's degree at Georgetown University.
Okay.
Subsequently went to Albany Medical College for medical school for 4 years, and then came back to Georgetown, did 5 years of residency in vascular surgery there. And then I made the decision to pursue heart surgery in addition to that, went to University of Texas in Houston, where you know, the greats of cardiothoracic surgery emerged from Michael DeBakey, Denton Cooley, and trained under their trainees. And since then, I've been pursuing, you know, the full breadth of cardiothoracic and vascular surgery with a focus on aortic disease.
I love that you said full breath too. That was actually very, very poetic. Aortic disease.
Yes.
Talk to us, tell me.
So the aorta is a fascinating organ. It's something that most people don't really think about, but it's the biggest blood vessel in the body. It comes directly off the heart, and it's shaped very interestingly like a candy cane. So it comes up straight up off the heart and then makes a big turn as it gives off branches to the head and the arms, and then goes down, straight down towards the rest of the body, that bottom part of the candy.
Because the aorta pumps the blood out.
Pumps the blood to the entire body, supplies blood to the whole body.
Okay.
And it's subject to disease. It can fall apart for a number of different reasons, smoking being the #1 risk factor for almost all types of aortic disease.
And isn't that crazy that a lifetime ago, smoking was glamorized? And smoking was, you know, if you pick up this
Right.
Philip Morris cigarette, you're going to have a great life. And it is now, as you said, the number one killer in regards to.
Absolutely.
Why do you feel that so many people smoke knowing what you are here telling us?
I think it's because they don't know. I think people don't realize that smoking is not just about lung cancer. It causes widespread vascular disease, causes blockages in arteries, causes aneurysms in arteries, particularly the aorta. And that's why Medicare recently started a program that allows people that have smoked more than 100 cigarettes in their lifetime to get screening for aortic disease. So somebody like you, who's had a history of smoking, is eligible once you reach Medicare age to have a screening ultrasound done of your aorta to make sure that you don't have an aneurysm and to rule that out as a potential cause of, of death down the line. It's a silent killer that people don't realize and don't think about.
Well, I think most people, even to the point of like obesity, we are the most obese country in the world. Over 78% of the United States is obese. And, a lot of people think, which then contributes to everything that we're talking about in regards to heart health is,
Absolutely.
Well, I don't know how I became obese. Well, yeah, you do. Other than hereditary maladies,
Right.
and things that hopefully we all pay attention to and ask questions about and say, hey, mom and dad, is there any hereditary illnesses I need to be aware of? It just doesn't happen. We don't just wake up and go, oh, I'm obese. Everything we put in our body, every unhealthy choice turns into a lifetime of large choices that possibly can take us out.
And I think that's why programs like this are so important, and education is so important, to let people know really what they're putting themselves at risk for when they make those types of poor decisions.
See, I love that you said that. So Doc, are you okay if I call you Doc?
Absolutely.
What is the difference between an aortic dissection and an aneurysm?
So aortic aneurysm is pretty straightforward. It's basically a ballooning of the artery, of the aorta itself. The aorta should be about the size of my thumb.
Okay.
No bigger than that. But when it balloons up to about 2.5 times that big, the risk of that artery popping, just like any balloon that's blown up too big popping, becomes so great that it requires repair, requires surgical intervention.
What causes it to balloon so big?
2 things. Number 1 is smoking. Number 2 is high blood pressure.
Okay.
Those 2 things weaken the wall of the vessel over time. So smoking deteriorates the proteins within the wall of the aorta over time and causes it to weaken. And the high blood pressure constantly pushes pressure on that balloon to the point where it's at risk for rupturing, bleeding, and causing people to die.
Up until the possibility of it ballooning and popping, how strong is that wall?
The wall is extremely strong.
Okay.
It will last your whole life without any problem. And most people who've lived a life without smoking will never have a problem with their aorta.
Since I quit smoking 16 years ago, and I just had my lungs CAT scanned.
Yes.
And great health. This is the healthiest I've ever been.
Right.
Do I need to worry about that coming up and kicking me in the behind?
Absolutely you do.
Okay.
Absolutely you do. Once you reach the age of 65, which I'm sure is far, far
It's
in the future for you,
25 years.
then I would encourage you to get
Okay.
screened by the new Medicare guidelines, have an ultrasound done of your aorta,
Love that.
and see what the diameter is. The average rate of growth is about 3 millimeters a year
Okay.
for somebody that has an aneurysm, and that can put you over the threshold once it's discovered within 5-6 years afterwards.
And before we already step out, and the way to bring the quote unquote candy cane, the aorta,
Yes.
back to normal size is quit smoking, is to start
Control your blood pressure.
control your blood pressure, which we will talk about when we come back. Don't go away. More with Dr. Ornekian when we come back. Thanks. Welcome back. Joining us is Dr. Vahram Ornekian. Did you like the Armenian spin on
I
that?
did. I appreciate that.
So during the break, as we were talking, in regards to an aortic dissection,
Yes.
Are there signs and symptoms to it? Like if you're feeling something like, hey, I'm having an aortic dissection, or
Right. So
what are we looking for?
both aortic aneurysms and dissection can present with chest pain or back pain.
So it's an aortic aneurysm, aortic dissection. Are they one and the same?
They can present similarly. The
Okay.
symptoms can be the same, but they're two different things.
Okay, so
So the aortic aneurysm we talked about is the ballooning of the artery.
got it. Okay.
Dissection's a little bit different. Dissection's interesting because when we think about the blood vessel, we think of it as a one-layered object, but
Sure.
it's not. It actually has multiple layers, kind of like this rolled up tube.
Okay.
So when an aortic dissection happens, it's actually a tear between the walls of the vessel,
Okay.
and the vessel walls separate from one another. And
Can the tear repair itself?
no,
Okay.
it can't. The tear will not repair itself unless surgically intervened on. And the reason the tear is so threatening is because it can cause stroke, it can cause heart attack, it can cause bleeding, and it can even cause paralysis or lack of blood flow to the legs. Any blood vessel that's supplied by the aorta can have an obstruction that's caused by that tear.
Okay. So as strong as our aorta is, it's also very vulnerable.
It's absolutely vulnerable. And dissection, that tear in the wall, happens in situations where we have extremely high blood pressure.
Okay.
Typically, patients that abuse cocaine, for example, that have extremely high blood pressures associated with that, people that don't see their doctor and don't take their blood pressure meds for a prolonged period of time, can have a sudden tear. And that'll present either with chest pain or back pain, lower back pain, can sometimes present as a stroke, can sometimes present as paralysis in the lower extremities. And that variability of presentation, that variability of symptoms is what makes it difficult to diagnose unless people are attuned to that.
And they also know what they're looking for.
Exactly.
So you said chest pain, back pain, same thing with an aneurysm in regards to symptoms?
Aneurysms will present, if they're in the abdomen, with abdominal pain or back pain
Okay.
in the lower abdomen, abdominal area. They can present with chest pain as well, or upper back pain
But then
as
wouldn't
well.
you think that's a heart attack?
You might, and oftentimes in the emergency department, physicians mistake that for a heart attack. And patients have even gone on to have heart stents placed before realizing that they're actually suffering from an aortic dissection or symptomatic aortic
So
aneurysm.
then how does that, you're a doctor, how does that get figured out then? Is there something a patient can do where, just say, 911 comes to your house if you're having
Right.
signs and symptoms, and they know the difference, or is it left to the doctor?
So it's difficult, and I think education is the most important thing. It's educating primary care doctors, ER doctors, to be on the lookout for that, especially in people that have risk factors. People that have really, really bad high blood pressure, people that have a strong history
Are
of
we
smoking.
looking for age too in regards to risk factors?
Age is a risk factor, but it can happen in young men as
Okay.
well. I've seen many young men, your age, my age, younger, who either don't take care of their high blood pressure, haven't seen a doctor, or have an episode of super high blood pressure and can suffer an aortic dissection as a result.
Signs and symptoms same for men and women?
Women, it's always more difficult to diagnose. It's true for heart attacks, it's true for just about anything.
Because?
Because there's an inherent bias among physicians when it comes to treating women that unfortunately, their complaints aren't taken quite the same way, aren't thought of as serious or as life-threatening as when they present with men. When we think of men, we think of heart disease, we think of heart attacks. But with women, we typically don't, and that's what makes it even more challenging when it comes to women with this problem.
Well, what's also interesting, though, is when we spend a lot of time talking about breast cancer and breast cancer awareness here, and out of every new 100 diagnoses, 1 to 3 are men. So I'm a huge advocate of men still do self-exams and check yourself.
Absolutely.
Because most people don't know. He's a guy, he's not going to have it, and a friend of mine is a retired vet. And he, in his mid to late 60s, had breast cancer. And he had to have surgery to remove the cancer on his pecs. So I believe that it can happen. Signs and symptoms are the same,
Right.
just play themselves out differently. Okay, so doctor, somebody comes in to see you and they have an aneurysm or dissection. What is the treatment then?
Number one is getting their blood pressure under control. That's the first thing that we do.
Okay.
We got to get their blood pressure down and try to reduce that risk of them bleeding to death from this
Wow,
problem.
okay.
So that's the first step.
How long does that take?
Usually minutes.
Great.
And we work very quickly to do that. The second step is getting them set up for surgery and getting this problem fixed, getting the aorta itself repaired. And that can be done in one of two ways, either with open surgery, the traditional way we've done it since the 1950s, or now with endovascular surgery, which is the newest technology that we use to tackle problems of the aorta.
I didn't realize, well, here's the thing, are both surgeries 50-50? I mean, the way that we all know is that you go through the chest.
The standard big incision versus the use of endovascular surgery have vastly different outcomes.
And when you say endovascular, what does that mean?
That means repairing this artery, this large artery, from within the blood vessels.
Okay.
So we access actually the femoral artery here in the groin, and we can deploy a number of different devices to treat these problems without having to make a big incision, without having to even put people to sleep sometimes.
Seriously?
Yeah.
Okay, we actually have a prop. So when you come back, Dr. Ornekian is going to show you exactly what he brought, and we're going to remind you and kind of beat it down to you on how to live a healthy life and how to quit smoking. Don't go away. Welcome back. Joining us is Dr. Vahram Ornekian. His specialty is cardiothoracic surgery and vascular surgery. Doctor, to me it's fascinating because when you think of heart surgery, you think about the huge incision, and of course you watch, Grey's Anatomy and all these hospital shows, and it's the cracking of the chest and going in, but you're sharing that you brought an instrument that can go through the femoral artery.
Right.
And do basically the same thing. So please share with us what that is.
So traditionally, yes, we would repair all aneurysms with a big open incision either in the chest or the abdomen, and we'd use this material, which is a polyester. It's like a cheap pair of pants. Take a feel of that. This is like, it's called Dacron, and this was invented in the 1950s and sewn into these grafts by Michael DeBakey and his wife on their home sewing machine. And since then, we've come a long way. So whereas that's the gold standard and will work, it puts people at a lot of risk. Not only do you have to go to sleep for that, but there's a long recovery in the hospital. Days, weeks in the hospital.
Because it's not so much just about getting to the aorta, it's also the recovery in the muscles, in the chest cavity, and all of that.
And the bone that has to be sawed open. Got it. So the alternative that we have nowadays to that is something called aortic stent grafting. So this is an aortic stent graft. This is a piece of PTFE or Teflon that's in a fabric form that's sewn onto this stent that sits inside the aorta. And what this does is it reroutes blood flow. So instead of...
Does that replace the expanded candy cane?
Absolutely. So you can imagine an expanded candy cane, if you implant this within it, that part of the aorta that's weakened no longer feels that blood pressure, no longer can enlarge. So these are implanted, like you mentioned, from the femoral artery. And I have one of these devices here with me. So it sort of sits on a very long delivery shaft like this. But this tip is what controls and houses the stent itself. And what I'm going to have you do here, take a hold of this, and you can imagine this sitting inside my artery. Okay. And go ahead and twist that open. Okay. And pull straight back towards you. Keep going all the way, all the way, all the way, all the way. So this is now halfway deployed. You see that? Okay. So this gives us a little controlled deployment. Now go ahead and turn this gray knob.
This one right here?
Yeah, you can let go of that. Okay. No, turn this left this way. Okay. And pull that straight out. And there you go. The whole thing is now deployed inside the aorta. So just like that, without having to make any kind of incision, just through a puncture in the groin, you've been able to deploy this inside the aorta and fix either a dissection or an aneurysm just like that.
Is every... Okay, that's phenomenal. Is every patient a candidate for this?
Most are. There's a few circumstances in which it can't be done.
And what are those? Could it be age? Could it be that...
So the older the patient, the more we err on the side of doing something like this.
Because of the recovery.
Because the recovery is so much better. The issue with doing this type of surgery is that it requires surveillance over a long period of time. You have to have CT scans every year to evaluate and make sure that it's in the right position. With open surgery, you don't have to do that. So for a young patient that you don't want to expose them to that surveillance and radiation over time, we err on the side of still doing the traditional open surgery the way it's been done since the 50s.
But everything is a conversation with your doctor.
Absolutely, absolutely. And even for young patients, especially ones that have suffered some sort of trauma to the aorta or some kind of injury, a stab wound or a bullet wound, this is such a fast and easy way to get it fixed that even for young people we use it.
I love that. So doctor, high blood pressure.
Let's talk about
How
it.
do we take care of blood? Because first of all, high blood pressure is hereditary.
Right.
How do we take care of high blood pressure?
Number one thing to do is to see your doctor and have your blood pressure checked. You can check it at home. You can check it at the Rite Aid while you're waiting for your prescription, or standing in line for whatever reason. You can check your blood pressure, and you got to know that anything above 120 used to be high. Now it's anything above a systolic blood pressure of 110 is considered high blood pressure. So the thresholds have even changed over time because we recognize how important it is to get it treated.
And also one thing too is talk to your parents, talk to your grandparents about family history. I say this all the time, that if something does happen and you do need to call 911 or emergency and an ambulance comes and gets you, have something in your wallet, or ladies, in your purse or on your bulletin board or something, where you actually break down your family medical history, the medicines that you're taking. Because sometimes if somebody is unconscious or not able to tell the ER group or the triage what medications they're on, they don't know.
Absolutely.
So just give them a roadmap to your health.
Absolutely. And talking to your parents and your family is very important. High blood pressure runs in the family, there's no question of that. And even young men and women, my age, even younger, don't realize that they need to be seeing a doctor and need to be on medication for these types of things. It's rampant, especially in the African American community, who suffer from very high blood pressure, and there's a genetic component to that. In the Armenian community here, not only is smoking so rampant, but there's also a tremendous amount of high blood pressure that goes untreated because people just either don't trust seeing a physician or don't want to take medication.
But they're also old school and they don't talk about it. And here's the thing too, it's a conversation. And I would love everyone to put down their phones and talk to their family and, go in as a family. And, what is this, the whole thing about the Mediterranean diet? Right. It's all about greens and olive oil. Olive oil is basically a huge kiss of health to your heart, is it not?
And if we ate and drank like our ancestors did in the old country, we probably would be much healthier.
This is true. True. And in regards to heart health, tell us what we got to do.
So like I said, number one, you have to stop smoking.
How do you tell someone to because here's the truth, as we were saying during a break, you smoke, you die. I watched my mom die in front of me. And when I tell people that are smoking, oh my God, that's so sad, I'm like, you're right. I still smoked for a couple of years afterwards. I did. And it was the hardest thing I've ever had to do. But I remember killing my last cigarette and I went, I'm done. And there's tons of, there's support groups, there's 12-step programs, there's outreach, there are detox centers that can help you with smoking, with alcohol, as you were talking about, cocaine and drugs. So, and because we have the internet at our fingertips and our phones, you can reach out to any support group and somebody is there 24/7 to help you go through it, because you're not the only person going through this.
I'll tell you the same thing that I tell all of my patients. Why is it important to quit smoking cigarettes? Because this body that you've been given is a gift from God or whoever it is that you believe made you or brought you to this world. And every cigarette that you pick up is an insult to that maker, is an affront to the body that you're living in, which is a glorious machine that functions beautifully. And to have poison that you put into it with a cigarette is just a shame. And it's not just, like I said, lung cancer, but it's all types of other cancers. It's heart disease, it's aortic aneurysms, dissection, all these other things that you put yourself at risk for every time you pick up a cigarette. So the bottom line is, if you quit smoking, your life will change so much for the better. You'll extend your lifespan, you'll extend your healthy lifespan, and you'll be able to live a better life in old age.
Doctor, thank you. So will you come back?
My pleasure. Thank you so much for having me.
Because we have more heart to talk about. So, COVID put so much of our lives on hold. It's been around for more than a year. And I'm sure it's been over a year since you visited your doctor. You are due for an annual checkup, no matter your age, gender, and overall your health. Please, schedule a visit with your doctor today. And if you need one, you can find a local physician by visiting adventisthealth.org/doctors. Our mission here is to have you be as healthy as you can be. And that just means taking the information and passing it on and putting down your phone and having a conversation. Our conversation today was all about you and your heart. We need you here for a really long time. So if you plan to quit smoking, have a conversation about it. It's as easy as saying, hey, you know what? I'm really afraid to quit smoking because that's what I did. Please reach out to me. Let me walk with you on this journey because, again, we need you here for a really long time. You can find us here at Healthline on all of our social media, and you can always find me at Gregory Zarian. Be well, be safe, and the most important conversation you're going to have is about you and your health. So start talking about it. We'll see you next time. Thanks.